eminent speaker, Dr. Renetta Weaver. So, Dr. Renetta Weaver is a board-certified metaphysicist, professional, and licensed clinical social worker. As a neuroscience coach, certified bar- bariatric counselor, and holistic life coach, she combines mental health, metaphysical practices, and holistic approaches to enhance well-being. Dr. Weaver integrates scientific knowledge with metaphysical principles to empower clients to achieving comprehensive personal growth and optimum health. Her transformative coaching and counseling reflect her commitment to supporting individuals on their journey towards wellness and fulfillment. Dr. Renetta Weaver will discuss enhancing mental health and well-being through AI, insights from a social worker. Please join me in welcoming Dr. Renetta.
Before I get into my presentation, I just want to talk a little bit about. Someone asked me upstairs just at lunch, like, how did you get into AI, right? Artificial intelligence. And so my story is that I was taking a class one day and someone came in and just talked about Chat GPT, much like you all have been talking this morning. And I got really curious and interested in it. Um, but what really happened is my mother-in-law got sick and she ended up passing away. And me being a good daughter-in-law, I just wanted to find out how I can help her family who was grieving. So they said, hey, if you could just help us do the funeral program, if you could write that, we would be grateful. So I said, okay, just tell me a few things about your mom. Make sure I get her name right, the family's name right, all that stuff, where she grew up. And I put this information into ChatGPT, and ChatGPT, in a matter of minutes, brought out her entire obituary. It brought out her funeral plan. It brought out a tribute from the family. It brought out everything. And I gave it to my sister-in-law, and she was so relieved because she did not have to do that, and it was done. So that's really how I got into it on a personal level. And then on a professional level, I'll talk a little bit about that as we go on with the presentation. But I want to ask you all, how many of y'all have at least been in your career for 5 or more years? Anybody? Okay. All right. Anyone been in 10 or more years? Okay. All right. I've been in my career for 20 years. And over those 20 years, I've seen a lot of changes. So a lot of people start with the pandemic and say the world has changed. But in my world as a social worker, it has really changed over the 20 years. Okay? Because when I first started, we were writing our notes on paper and putting them in files and putting them in file cabinets. Now everything is automated. We're putting everything in electronic health records, but that's not the only change, right? The other change is the cell phone you're probably holding in your hand now is not the cell phone we had. We didn't have cell phones. We had phones with cords. We had pay phones, okay? We didn't have a lot of the technology, and it switched from that to like pagers on our hips. And then when we did get a cell phone, it was the big pocketbook type of cell phone. It was so huge, right? So these little tiny devices that we carry in our hands right now, that has changed, right? But not only that, the way we see clients has changed. Because when I first started in my field, we were visiting clients in the community at their homes. Now, I have gone from being in their homes to them coming in my office to me not even having an office. I'm seeing my clients face to face over the computer or either talking to them on the phone. So a lot has changed, and I've had to adapt to that change as a social worker during the past 20 years. But then came the pandemic, and we couldn't do anything like we used to do. The whole world was different. And so we all had to adjust. Clients had to adjust. We had to adjust as providers. We had to figure out how we were still going to service people at a time of high stress and high anxiety. And so AI has been a game changer for me as a social worker and for my clients. And I just want to talk about that. So a lot of people, when they hear AI, well, there's two types of people. People like me that get way excited, and then other people, right? They get really scared. Is AI going to take my job? Is a robot going to take over what I'm doing? And I'm like, you know what? AI is going to change and take a lot of jobs. It already has. But it's also going to create a lot of jobs and a lot of opportunities. And I work on talking to people as an AI consultant about the opportunities. And that's what I want to share with you today. Before we go further, I want to see if I can play this. Oh, how do I turn it? GRC is finally here. Cambridge calling far and near. August term, let's make it. Hey, made with AI. Ideas blue like summer sky. Research dreams that touch the high. Scientists with vision wide. Innovation side by side. GRC in Cambridge town brings the world around. August time we share the crown. Love and joy and proud. Posters, talks, and coffee breaks. New connections, friendships make. Brains on fire, no mistake. Together we create. Dancing nights and morning light. Chasing knowledge feels so right. August sun in Cambridge bright. We unite with all our might. GRC in Cambridge town brings the world around. August time we share the crowd. Laughter, joy, no frown. GRC in Cambridge town brings the world around. August time we share the crowd. Laughter, joy, no frown. GRC in Cambridge town brings the world around. August time we share the crowd. Laughter, joy, no frown. Laughter, joy, no frown. Woo! Laughter, joy, no frown. That's when I looked at your faces, all I saw was smile, even from you, young man. Thank you. Okay. Thank you. So I will tell y'all that was made with an app called Suno, Suno, Suno. I want everyone, if you can, to write that down, Suno, because I believe all superheroes need a theme song. And you can go in Suno and create any song you want by just putting in a few keywords, putting in the genre of music, whatever type of music you like, and it will create your own theme song, okay? So Suno.ai. And the video was made by Pictory, Pictory. So this allows you to be creative in your business. If you have a website or if you want to do social media, it allows you to be a little creative. So back to the business at hand. As I said, I've been in this field for 20 years. Someone said, you know, you're a senior social worker, right? And I said, I am? I couldn't believe I was a senior social worker. That means I'm older than what I thought I was, right? But the truth is, I've been doing this for a long time. And over the years, with all the changes, it has led to even me being burnt out. As much as I love my job, as talking to my clients, there's a lot of reasons why I got burnt out. Just all the admin stuff. And there's a high prevalence of burnout in the field. So we're losing a lot of great providers because of burnout. And it really has an impact on patient care. So when we think about the theme of the conference, sustainability and resilience, I really didn't want to talk about how to do that for our clients. I think we go to a lot of conferences and they talk about that. I really wanted to talk about how we can do that even as providers, right? Professionals, whether we're clinicians or working with the public in some other way. I really wanted to talk about how we can do that. Really, what I wanted to do was just find a way to talk to them about grief, because we had lost my father-in-law 2 years beforehand, and now their grandmother had passed away. And I said, nobody's going to talk to them about grief because we don't talk about grief, and we definitely don't talk to children about grown topics. So I wanted to find a way to talk to them. And I started putting in Chat GPT, like, please help me come up with some ways to talk to my niece and nephew. And by the time I called Chat my little assistant. So my little assistant and I were talking back and forth. By the time we finished talking, I said, this sounds like a book. And so I put everything in a book. And I do let people know that the pictures in the book came from AI. I didn't draw them. The concepts came from me because I had to program Chat with the things that I wanted in the book. And Chat, as my assistant, enhanced what I was giving it. So it didn't write the book for me because the concepts came from me, if that makes sense. As far as my clients go, we talk about how it can support diagnosis and treatment and monitor patients and reduce provider workload, right? And I think we hear that a lot. Like, we know there's technology out there that can help do that. But we often don't talk about the creative side. So as I said, AI doesn't take over. It just augments what we do. And I've been able to use Chat GPT, and y'all can pass that around, to create coloring books. Oh, I gave it to the right person. Self-talk. To create coloring books, right? So when clients can't get in to see us, like when the pandemic happened or for some other reason, we can actually still have an impact and work with them in spaces like we didn't used to be able to do. Because we can create products to extend our reach to clients, and they don't even have to see us, but we can still have that impact on them. So I say AI saves us time, saves us money, and increases our productivity, right? So I didn't put it in the slide, and I have to apologize for that, but you can go right into Chat GPT and build what's called GPTs, and you can personalize your care. So what I have done in Chat GPT is develop a few GPTs for my clients, like mental health things. So they can put in a topic, a mental health topic, ask it a question, and it will give them feedback. And you all can do the same thing. So everything that I'm saying today is to inspire you to do the same thing. So AI-driven mental health platforms can improve access to quality care by up to 400%. And 73% of mental health facilities increased their online support tools in 2022, and 89% reported improved accessibility through AI-enabled chat. It's basically saying that clients, they have more success with clients because clients don't have to come in the office and feel judged and see us face to face. They can just be over this AI device and still get the help they need, and they're more likely to do so. Okay, so I'm going to play this real quick. I don't want to be up here all day, but I just want to give y'all an example of how we generated AI materials. And then I want to give you an example of how you can create a course real quick, because we all heard about LOSD and their initiatives about creating courses. And if that's something you're interested in, I have a tool that can help you do that. So let's see if I can do this quickly. Okay. This first one is Gamma. This is the one that's going to help you create the presentation. You go to Gamma. I'm going real quick, but you put in where it says generate. You put in anything, any topic you want to put in. I put in self-care. Look at how quickly it generates. That's in real time. And then you hit confirm after it does your outline. Then you pick a theme. And this is real time. I didn't speed up the video or anything. So I'm talking fast because I'm trying to keep up with it. You pick your theme. I'm just toggling up and down to show you there are lots of themes. But once you pick a theme, you give it a title, you click generate, and watch how this generates your presentation. So if somebody came in your office and said, hey, I need you to do something in 30 minutes, you can do this, okay? You can create your own presentation, and it looks really professional with pictures and everything. Now, you can change out the pictures if you don't like something. You can even change out the outline if you didn't like that, okay? But I just wanted to show you all quickly that this is what it can do. So I know a lot of people are afraid of AI taking over and all that, but didn't I say AI can like help you create as well? So this is what I do as a consultant, is just help people go from AI fear to AI fun. Okay, and I'm just showing you quickly how you can change a picture and put it in your presentation. So we talked about, I really like the professor who talked about, being a college student and letting AI do all of your work, right? Because you're not, it's you have to keep everything in balance, and you have to use these tools to augment what you do, not substitute what you do, right? You still have a mind, and you still want to cultivate your own thoughts, and just let this amplify it, right? So there are a lot of biases in AI, and you have to be really careful. Even with images and pictures, right? I'll ask it to draw me a person of color, and it'll come out with a figure that doesn't really represent. And I'm like, hey, I don't like that figure. Do it again, right? So sometimes you got to kind of fuss at AI until it gets it right, but it will. And then, you don't want to rely on AI to do everything for you. You still want to be involved in it. So when I talk about human oversight, you don't want to just trust everything it gives you, because actually people are training AI as they use ChatGPT, they're training it too. So you want to make sure that it's giving you right information. So I just wanted to see, I know that was kind of rush, but I didn't time myself, and I don't want to go over time. Just wanted to see if you all had any questions for me. Now, did you all enjoy? I have a question for you. Did you all enjoy it, and will you all create your theme song? Okay, I want to hear it, because as you see, I like to dance. All right, thank you so much.
Thank you so much. I especially love that GRC tune that you actually had going for us. So thank you so much for creating that and sharing your knowledge on that.